Good morning, my name is Lorraine Williams. I'm the Infection Prevention and Control Lead for East and North Herts, and I have the privilege of serving the Trust and looking after the Infection Prevention and Control team. This has been an extraordinary year, and I wanted to tell you just a little bit about what's happened during the year. Before coronavirus came, we were lucky enough to have a data system installed called ICNet with the help of the IT team from the Trust. That was fantastic because it enabled us to deal with microbiology results in a really speedy fashion. It allowed us to start thinking about surveillance and reporting programs as well. We also saw the continuation of our hand hygiene competency, which we were really excited about. It meant that by the end of the year we had seen over 2,000 staff go through the hand hygiene competency, which really kept us in good stead when the coronavirus did actually come about. However, the last 6 months have been an incredible 6 months, and I know that people have said that it's an unprecedented time, but it really has been an unprecedented time for the whole world and the nation, the NHS, but also here at the East and North Herts Trust. I'm so proud of the Infection Prevention and Control team who've worked tirelessly, professionally, selflessly, for the past 6 months to think about ways to keep the Trust safe and to look after the patients that we have and to look after the public as well. We didn't do it alone. We were led by our Director of Infection Prevention and Control, Rachel Corser, our Infection Control Dr. Saba Kaiser, our senior Ip&C team, and also the execs and the senior teams around the Trust. This has been an incredible collaborative effort. From the week beginning the 23rd of January, Rachel Corser, Julianne Smith, our Chief Operating Officer, and Penny Halford, our EPRR lead, we began talking and discussing this Wuhan virus and how we as a Trust needed to prepare for it and what things we needed to put in place. May and the rest of the Infection Prevention and Control team worked tirelessly to think about ways that we could both track the guidance coming out from PHE and monitor the guidance and put it into practice so that we could keep the Trust safe, we could keep our patients safe and the staff safe also. Ip&C staff like Ian and Alison, who'd retired, came back so that they could serve the Trust, and we're really grateful to them. We did countless donning and doffing demonstrations, and then Danny and May came up with the ingenious suggestion and took it up a notch by including Bok and a clinical photography team and thinking up a video, and we produced donning and doffing videos. The respiratory consultants came and helped. I know that Dr. Wilkinson and Dr. Chong helped us with our community hub question and answer sessions, just so that we can be sure that we could answer any questions that the staff had, or even the public and patients who walked past that. And then Dr. Wilkinson put forward an amazing cohorting idea, which went on to prove pivotal in the keeping the patients and the staff safe throughout the whole crisis. The training team did amazing things with the guidance that was produced, and we came up with a lot of the guidance, and they, along with the PPE champions, translated that into practice, which we're really grateful for, under the leadership of M&M and Trace, and the community responded amazingly to that. We're really grateful to the communication team. The guidance came out on a daily basis at some points, and they translated that into messages that went out through to the staff through their bulletins, again responding on a daily basis, and we're really grateful. Professor Jenny Wilson, the Vice President and soon to be President of the Infection Prevention Society, came along, and she did one of our very first webinars with the question and answer sessions, and she answered many of the questions that we had as a Trust and stood us in good stead with the PHE guidance. The clinical response was amazing, but so too was the non-clinical response. I want to say thank you to the pharmacy department, who asked very early on for us to come and answer their questions, and as a result it enabled them to continue to serve the trust, going on to wards safely, understanding what precautions that they needed to take. We're also grateful for the IT department and the star leaf sessions that we did right at the beginning, and the technology that they brought in to enable us to keep getting those messages out. We're really grateful. The facilities department were amazing. They acted really heroically, whether it be thinking about what to do with scrubs, or they also helped order in the PPE. So at times when actually there was a national shortage, we were able to call on the facilities departments to help us with the supplies that they had managed to store. They really kept the trust going in terms of the cleaning, the environment, and the catering. I also need to say thank you to the porters. They faced the fear and found out about the ways that they could keep themselves and patients safe. They transferred our COVID possible or positive patients around the trust with great professionalism, and we're grateful to them. Also, when we needed to think about how we could distribute the amazing amounts of PPE around the trust, again the porters stepped up. They manned a 24-hour PPE store. They responded heroically, and we are really grateful to them as a trust. Thank you so much for your hard work. G4S stood side by side with us and faced all of the fears that we had. They equipped their staff with the knowledge. They worked with us. They equipped the staff with the PPE, and they carried on giving us a great service throughout this time, and we are really grateful to them as a trust. The collaboration was endless. As you can see, the Ip&C effort was not just down to the Ip&C team and the consultant microbiologists and even the senior leadership teams and the exec. It was all of you. We are really grateful, and we thank you so much. We thank the members of the public, we thank the patients, and we thank the staff for all of the tireless work, working with us as an Ip&C team, following the guidance and trusting the messages that came from the Department of Health and Social Care. However, we know that moving forwards that we need to continue with this collaborative spirit. We know that the challenges are not over, and we know that together we can face this, putting first our trust, values, and working together, we will go on to do incredible things in the East and North Hearts Trust. Thank you.
Just want to highlight the beneficial relationship between facilities and infection control. So the infection control team, they've been working in cordial relationship with the facilities team in ensuring that we are always kept abreast of what is going on in the trust in terms of patient safety and the health and safety issues concerning staff. So in facilities, we've always relied on the guidance coming from the infection control teams, i.e. during the outbreak period, when infection control will inform facilities when to provide linen services, i.e. the scrubs, to the wards when it's needed, or the catering in terms of meal that goes onto the ward, as well as ensuring that portering departments are fully abreast of what is going on in various wards, so that people are not just walking in and out of wards transmitting the infections onto others. So I want to say the working relationship has been very beneficial. And I want to also add that during the COVID infection control team, I was surprised that they've asked us in facilities to support the ordering process with gowns, aprons, and all the rest. So we really appreciate this beneficial working relationship between facilities and infection control, which I believe is tremendous. When two teams are working hand in hand to make sure that things are going on in a smooth manner. So I want to say, we've had a very good working relationship with infection control, and I hope that carries on, as we move forward from here on.
My name's Katie Sparrow and I'm an account manager for G4S FM, and we manage the domestic service contract at Leicester Hospital. The infection prevention and control team have been absolutely vital in raising the profile of the domestic services and the important role of the healthcare cleaner in our hospitals. During the time of the pandemic, the infection prevention and control team and the processes and training that they implemented made me and my teams feel incredibly safe in the workplace.
The relationship between EPRR and Ip&C went from strength to strength for day one for planning for COVID-19. This was an approach that provided a robust plan and amazing support. I will be forever thankful for making a hard job easier with the support of a friend.
During this challenging coronavirus pandemic, the Trust's Ip&C team has worked tirelessly, together with our consultant microbiology colleagues, to coordinate the Trust's Ip&C response, offering prompt guidance, steady leadership, and sound advice to the wider Ip&C teams. For this, and for all the work that they do, we are extremely grateful.
Our digital team want to say a huge thank you to Lorraine and May from the Infection Prevention and Control team for all of your help during COVID, potentially one of the challenging times in your career, yet you still maintained care and compassion. You helped our teams and assured them when they should and shouldn't use PPE, and you never stopped smiling, so thank you so much.
The Infection Prevention Control team conducted a session with my team and provided them with information on hand hygiene, PPE and infection control in general. They were really anxious about seeing COVID-19 patients, and you've made them feel really safe and relieved all their anxieties about going to see them. Thank you.
As a member of the respiratory team, I've worked very closely with the Infection Prevention and Control team throughout the pandemic, and they've been working in very difficult circumstances with a huge amount of pressure, limited resources, and a constantly changing national background of guidance and advice. And I think they've done a tremendous job. Their efforts have been utterly heroic, and they've worked with great skill and tremendous energy throughout this time to minimise infection transmission within the hospital, and I think they should be strongly commended for their great work.